Thank you so much for joining us yet again here on Facebook. This is our AccuWeather Ready Facebook live segment that we've been continuing every Wednesday around 1 in the afternoon. So join us again next Wednesday as well as we'll continue this discussion. Today what we're talking about though is allergies, and we have Dr. Cybele Pacheco here. She is a family medicine physician, and we are talking about allergies that occur during the spring usually. Of course, we're getting into that season, and the symptoms that different people have as well. So thank you so much for joining us.
Thank you for having me.
And let's just get right to it. So what are some of the symptoms that people might experience when it gets into allergy season?
So most people know exactly what allergy symptoms are like. They're runny nose, runny eyes, sometimes a sore throat, maybe a headache. Those are kind of some of the classic ones that go along with allergies and allergy symptoms.
So a lot of those symptoms, at least when I experience them, I always think that I have a cold. Are there any maybe distinguishing factors that you can tell yourself if you have a cold versus if you're experiencing allergies?
Sure. So some of the symptoms are the same for colds and flu season as well. I think of the length of time that you're sick. So usually allergies are a couple of days and are really just symptom management. When you're moving into a cold or an infectious process, usually your drainage would change. So you might have that clearish drainage in the beginning, and then it might become what we would call purulent, so that yellowish green. And then you might have some associated fevers or chills that would go along with that. And those would be the times that you want to get checked out. That's when it's leaving allergies and going to an infection.
So how does this all start? What actually causes allergies?
So allergies present to the body, and they are called an allergen, something the body experiences as foreign. So it causes a reaction within the body, releasing these chemicals called histamines. And so that's why when we tell you to go and get things over the counter called antihistamines, some of the branded name stuff, some of the generic names being like loratadine or sertrazine, those would be antihistamines, and that's why we tell you to take those. They block that reaction.
So let's say someone comes into you and they're having these symptoms and they're trying to figure out, what they can do, what they can do to feel better and also maybe prevent any of those allergies from occurring down the road. What type of treatment would you recommend?
So first thing I say is that most people have had an allergy experience, whether you have allergies chronically or not. You can certainly have them intermittently, so associated with seasons. One of the things that I tell patients is if you have identified that you get those symptoms during that time, to start your medication beforehand. So if you start in May getting some seasonal symptoms, start your medication at the end of February or April.
So how does that work? How does it work when you take the medicine before you even have the symptoms?
So it starts to block the reaction, so you won't have it. Now, I'm not saying you'll block it completely. Sometimes you need additional therapies, but for the most part, you'll start to block the symptoms, block the histamine reaction, and then hopefully not be as symptomatic.
Oh, that's great.
And then through the season, you take the medication.
Got it. So that kind of helps you keep up with it.
Sure, sure.
Now, there are some medicines, I know, like Benadryl, for example, that when you take it, you feel a little bit drowsy afterwards. Are there any other options besides taking something like that?
So I think Benadryl probably isn't your best option, because you really want to do that antihistamine. So those medications that do that, and there are specific ones on the market that will work, some of the ones that I've mentioned already. Another big thing that you can use is saline nasal spray. So for those of you who don't like to use medications, just applying some of the just saline spray into the nasal area, kind of clearing out what allergens have gotten caught into the nasal mucosa and getting it out with either a sneeze or blowing your nose afterwards sometimes can alleviate symptoms.
So I just started using nasal spray very recently, and it's been a new experience for someone who's never done it before, and it feels a little bit uncomfortable.
Yeah.
I've gotten used to it, but are there maybe any different types of applicators that are maybe a little more comfortable?
Sure. So it does come as a spray bottle. I think it's like an ocean spray, similar, a salty water combination that would, if you depress the bottle, it delivers this spray into your nose. I find that uncomfortable as well, and especially for a mom who has a small child who I use this on regularly, I like the aerosolized can where it does deliver the spray to the back of the nasal passage there and really get to that area. And again, once you press that button, the amount is delivered regardless of whether you pull away or not. There's a Netipot too, which I didn't mention, and some people who have chronic allergies have found that this has abated them almost completely, which is a pot that you prepare your own saline solution and you deliver it into one nare and then it comes out of the other. So look it up before you do it, but that's another option.
Is there anything special that you need for that? Like any certain type of like sterilized water, for
Nope.
example? Oh wow,
No,
so you can
it's
just do tap water?
filtered water, I would
Wow.
say, and some salt.
That's awesome.
Yeah.
I'm gonna have to try that. Okay.
Try it out.
with the nasal spray applicators, you mentioned that you do that with your child.
Yeah.
I have a 7-month-old at home. How early can I get her started on that?
You can
Is she too
start
young?
as soon as she has symptoms. So if she's sneezing, and for children it's the same thing. They have the same stuff. Their eyes get a little red, maybe a little runny. They might say, my child ended up having some redness around her eyes because they were itchy and irritated. You'll have that clearish drainage that'll come from their nose, and they'll have crusties. You can use the saline nasal spray whenever.
Wow.
It's fine.
Good to know. And I just want to remind everyone at home who's watching, you're able to type in your questions in the comments section. We want to hear from you. We want to know what it is that you have, what your questions are, and we can hopefully get them answered for you. But I want to ask a little bit more. Are there any situations where an allergy to something like pollen or dust, where it could become a little bit more serious than just a runny nose and itchy eyes?
Yeah, so like I said, if any of your drainage changes and you start to develop secondary symptoms like fevers and chills, I would get checked out. Certainly if you have allergies that are producing reactions, what we would call an anaphylactic reaction, where your airway can be compromised, those would be times that you want to be talking and discussing that with your physician, and also seeing an allergist, having the necessary equipment always available, like an EpiPen, but perhaps getting some treatments like allergy shots and so forth if they're appropriate.
Sure, and that's so interesting to me because when you hear about anaphylaxis or you hear about an EpiPen, you usually think of someone who has like maybe a food allergy or something, you know, that's very serious and life-threatening. I didn't realize that you could actually experience that when it comes to just our typical spring allergies.
It depends. Some people have a little bit more of a severe reaction.
Wow, good to know. So what are the times of year that you tend to see more patients coming in with allergy symptoms?
You know, we were just talking about this offline. It's really May through the first frost.
Yeah.
That's kind of what I remember from quickly just reviewing, and it's different things, different allergens per season, nothing in particular. I think what is most important is the symptoms do remain the same regardless of the allergen, which is those runny eyes, that drainage from your nose, that postnasal drip where it goes to the back of the throat and you have this chronic cough. Some ear discomfort and headaches is a big one.
That's good to know. And we were also talking about how sometimes the weather can actually impact the allergy season. So for example, if you go a stretch of several days where you have nothing but sunny skies and maybe a little bit of wind, you're probably kicking up a lot more pollen in the air. Whereas if you go outside maybe right after it's rained, then there may not necessarily be more pollen in the air because it's kind of helped to wash it out. But you actually had a good tip for people at home after it rains in the spring.
Yeah, so if you are a person who does experience allergies and it's been raining, one of the things I tell patients is you can take your shoes off at the door so you're not tracking the allergens that may have now washed to the ground and now are part of your shoes and under your shoes. So take them off at the door before you're coming in and before you're tracking them through your home.
Yeah, I think that's such a great tip because it's not something you necessarily think of. You think, oh, it's all the pollen in the air that's causing the problem, not necessarily that you've tracked it in on your shoes.
Right.
So really good to know. Are there any other things that people can do at home and in order to prevent them from feeling these allergy symptoms?
Sure. You know, I think one of the biggest things is identifying when you feel affected. If you are a person who is affected at certain times of the year, you can just have a one-off where you're just having a bad season. You've been exposed to either a dog with a lot of dander or been in a particularly dusty home or a moldy home. You know, some of the things that you read about that you hear to do, or, you know, close your windows on windy days and stuff like that. I hate to say that, but if you're particularly affected, that might be helpful. But other than that, just taking good care, being aware of your changes in your body, addressing them appropriately, and then when they change, you know, bringing them to your physician's attention.
So speaking of getting your physician's attention, I think that there are a lot of different medications that are out there over the counter that if you're starting to feel your allergy symptoms pop up, you go get the nasal spray, you get maybe that over-the-counter medication. When is the point that a person should actually call their doctor and say, hey, I think I need to be seen?
That's a really great question. I usually treat if I've seen a patient for 10 days, but I like to know that symptoms have been persistent for a week.
Okay.
So 7 days, 5 to 7 days is kind of that cutoff that it's not pulling the corner and it may need some additional help in checking out.
I'm making that as a mental note for myself this spring so my doctor doesn't have to hear from me all the time.
We often get those. I've been sick for 15 minutes. I'd like to get in and be seen. But, and we will see you. But if you give it some time and do some good symptomatic treatment, a lot of times you don't actually need my help.
That's great. So we actually have a question coming in from Susan K. Myler. She wants to ask you this question. She says, she used to not have any allergies. Is it possible that they could arrive as she gets older?
And that is, and I'm sorry to tell you that, Susan, but yes, over time you can develop allergies. You may never have had them all your life and then suddenly develop them. So the good news is it's fairly easy to treat if you can grab those symptoms quickly, but on the other hand, unfortunately, you probably are going to start to suffer from some allergies from time to time.
So I'm a mom to a new child, and this might just be a selfish question because I want to know, is there anything that I can do to prevent my daughter from getting allergies down the road?
So, probably not.
Okay.
You know, there's always good hand washing. There's always, you know, reducing exposure, but, you know, probably not. I mean, you had mentioned that your husband has allergies.
Yes.
And some of that can be familial. So just watching for the symptoms and treating them symptomatically so they don't get any worse.
And can they be a sign of anything to come? Like, does anyone who has allergies, would they maybe be more at risk for any other type of disease?
So that's a good question as well. We in the medical field know of a triad that does occur with allergies and some what we call atopic dermatitis. Those people sometimes do suffer with an asthma or a breathing condition as well. So those are things that, again, if your allergies are getting out of hand, so you've treated for the 5 to 7 days, not getting any better, you go to your doctor, we start to make those mental notes. We may look for a rash. We may look to listen to the lungs to see if there's wheezing, and then we would take that next step in the treatment.
With that rash or that dermatitis that you mentioned, what are some of the symptoms of that?
So it often is what we call macular papular, so it's raised and pimple-like. So not quite a hive. So hives are kind of, can be flat, but they confluence, so they become kind of a big island and they just look red. These you can feel. They have texture to them. And they're not always that obvious most of the time. So eczema is atopic dermatitis. So dry skin would be another thing. And we look for those things and put those pieces together to make sure that we're treating everything we need to treat.
Oh, interesting. So it may, if you have allergies, if you're one of those unfortunate sufferers, you might also have those other issues like eczema or like asthma potentially down the road. So it's just maybe like a warning flag, something to keep an eye out for.
Well, it's something that's part of it. It doesn't necessarily mean you're going to get those, but when you see your physician, we will be keeping that in the back of our mind.
That's good to know. I get eczema, I get that itchiness, and I don't really have spring allergies, and as far as I know, I don't have asthma, so I guess one of the signs that you can have one of the three, but not necessarily all of them.
Absolutely, you can have any one of the three without them all being together, but we look for that triad.
Oh, we have another question coming in. Anastasia Muncie wants to know, do changes in barometric pressure affect your sinuses? So what I would probably say to this is that usually when you have a change in barometric pressure, when, for example, the pressure is going up, that usually means that you have a high pressure system coming in closer. And like I said before, that's when you have those hot and warm sunny days. Those days where you have a lot of sunshine probably allow the pollens to just build up in the atmosphere. Whereas when you have the pressure dropping, that could indicate that maybe you have a storm system coming on closer that would bring on the chance for rain, and that would likely wash those pollens away. So it's probably when the pressure is going up that you have the higher likelihood of maybe having an increase in those allergy symptoms. That's what I would imagine, at least.
I think that seems reasonable and appropriate. I wouldn't know anything necessarily medically that connects barometric pressure and you're increasing your allergy symptoms, but that seems really reasonable.
Yeah, that's just kind of just going off weather knowledge and what you've mentioned before with the rain helping to wash everything away. Have you, just as a funny question, have you ever noticed any specific trends in the weather that have led to higher allergy rates or versus lower?
I think I notice it more when it's ending.
Yeah.
So as soon as the frost comes in or we've had some snow, I start to see a real reduction in sinus infections and just allergy-related symptoms that are coming in. But right now we're in a peak season.
Well,
it's happening.
Yeah, it feels like it already. It's already
Yes.
I've started to notice some pollen trying to build up a little bit. Well, thank you so much for joining us for today.
You're welcome.
Anyone at home, please continue to ask your questions and we'll do our best to respond to them. We appreciate having you here, and I think we've answered all the questions that have come in. So again, thanks for joining us, and of course, come join us again next Wednesday at 1 p.m. I believe we are going to be talking about ticks and mosquitoes and how you can prevent yourself from getting the illnesses that come along with those specific types of bugs. So join us again next week.